Welcome to the 2023 American Heart Association International Stroke Conference in Dallas, Texas. I'm here today with Dr. Zi, who is one of the presenters of a late-breaking session that will be held the following day. Dr. Zi, could you please introduce yourself?
Yes. Thank you, Dr. Phil, and the American Stroke Association for giving me this opportunity to this interview. I'm Dr. Wenjie Zi, the Executive Chief of the Department of Neurology of the Xinqiang Hospital in Chongqing, China. And Chongqing is the largest city in China with 13 million population.
Well, thank you again for joining us. I know it's the wee hours of the morning in China, so it's very gracious of you to join us. We'd like to learn about your study with Tirofiban as an acute ischemic stroke treatment. Could you tell us a little bit about why you chose that agent?
Okay, so let me have a brief introduction to the background. It has been 30 years since the New England Journal of Medicine published the NEEDIS study, which best proved the efficacy and the safety of intravenous thrombolysis for patients with acute ischemic stroke. However, the strict 4.5-hour time window and the contradiction limited the use of IVT, and the other proven treatment was the endovascular treatment, but was only available for patients with large or medium size vessel occlusion. There are substantial patients ineligible or without response well for IVT due to the time window, and the contradiction, and ineligible for EVT due to no large or medium vessel occlusion but suffer from major disability. There was no current institute-based treatment except anti-thrombotic therapy.
Well, thank you very much. So as I understand it then, we're looking at patients who do not have a large vessel, medium size occlusion, and those who might exceed the 4.5-hour treatment window. Having said that, I'd like you then to go in briefly to some of the key methods in the study, and then we'll have you review with us the results.
Okay. The RESCUE BT2 was a randomized multicenter double-blind double-dummy trial aimed to assess the efficacy and the safety of the Tirofiban compared with low-dose oral aspirin for patients with acute ischemic stroke without large or medium-sized vessel occlusion within 24 hours of stroke onset or stroke symptom progression. This study wants to find a treatment option for this specific population. In 170 stroke centers and 16 provinces in China, which covers nearly 3/4 area of China, nearly 1,200 patients were enrolled in this study. About 40% patients were female with a median age of 68 and median NEED score of 9 in both groups. Tirofiban increased the proportion of patients with MS 0 to 1 at 19 days compared with low-dose oral aspirin. The absolute risk difference was 60.9%, and the adjusted risk ratio was 1.26, and reaches statistical significance. The rate of intracranial hemorrhage was 1%, which is low but slightly high in the Tirofiban group. This is the first clinical trial to demonstrate a treatment strategy for patients with acute ischemic stroke without larger or medium-sized vessel occlusion within 24 hours of stroke onset or stroke symptom progression.
Well, let me thank you for sharing that very interesting data with us, and let me congratulate you be one of the first to congratulate you on your positive result. This study will help save many patients who've had acute ischemic stroke, as you've indicated. Are there any take-home messages that you'd like to share with our audience?
This is the first clinical concentrating on patients with a specific population that with disabling acute ischemic stroke without larger or medium-sized vessel occlusion within 24 hours of stroke onset or stroke symptom progression. And this trial provides new insight into the treatment strategies that aggressive antiplatelet treatment using Tirofiban reduced the likelihood of disability for this specific population, which is without current institute treatment.
Dr. Zi, again, we wish to thank you. We look forward to your virtual presentation at the meeting tomorrow, and thank you again for joining us. So long.